Okay, our, our discussion now will be about connected health, which is already a big theme in America and the States. In Germany, it's growing. You can see it, for example, in Wikipedia. If you get in there, connected health, you find on the English webpage, you find a long article. In Germany, you find nothing so far. So for all those who don't know about the new term connected health, the definition in Wikipedia is it's a model for healthcare delivery that uses technology to provide healthcare remotely. So it's something like telemedicine, but it goes a step far, far beyond telemedicine because now you've got much more possibilities, not just talking to the doctor, but with the smartphones, with apps, with internet, with biosensors, you can get much, much more in contact and do a lot of more things. And people want to get these new possibilities. There was just a few days ago, there was a survey from the Techniker Krankenkasse, big private health insurer.
Not private.
Public health insurer, I'm sorry. And it's and of the people asked, of 1,000 people asked, 98% wish to be able to set up appointments with the doctor online. 81% wish to order recipes online. 68% would like to send medical data like your pulse to their doctor. And 52% more than they have want to get in contact with their doctor by the internet. So there's a huge, huge demand for these new possibilities. But on the other side, there's a huge offerings. It's about, on the market, there are 400,000 apps concerning medicine and health and fitness, and many, many are of a very, very varying quality. So it's only a minority has got consulted a physician or a psychologist first. So the market is very much in a movement, and you don't know how will the future be. Will chaos reign? Will the big players take over, like, Apple now with a health app, Google saying with Google Fit much more the same, or will reliable companies working with doctors push through to the market? That's things we want to discuss, and as guest, I'm happy to have as guest to introduce someone who doesn't need no introduction in Germany. It's D.Bahr. He's former health minister of Germany from 2011 to 2013. Now he's a member of the board of Allianz Private Health Insurance, to get that right. He was the biggest insurer of physicians in Germany, and Allianz, of course, being the biggest insurer worldwide. And D.Bahr, he's got an illustrious vita and a career, and I hope you don't mind me just cutting short through it, otherwise I will talk about all the time. You've graduated in economics, got an MBA with focus on international healthcare and hospital management. You were first elected to the Bundestag, the German parliament, in 2002, then acted as a health policy spokesman at the FDP Bundestag starting 2005, then moved on to the German government in 2009 as state secretary of the federal minister in health, and contrary to the popular notion that you don't need to be an expert to be a federal minister, he became our federal minister in 2011, and there pushed ahead a lot of reforms concerning the pharmaceutical market, concerning financial sustainability, which is a huge and the most difficult subject, I think, in every country of healthcare system in the world. So I guess that's the toughest job in the world. He pushed ahead long-term care insurance, accomplished cancer registries, a new system for organ donation. So that's kind of connected health too, on a different level. And now at Allianz, he's responsible for sales and distribution and reimbursement. And we are very interested to hear what you think about the new possibilities and new ways, among others concerning financial sustainability. So is it good if people, for the financial system, if people can get much easier to the doctor, or is it another cost driver? And one of the people who help us to get in contact with our doctors much more easily is S.Bolz. He's founder and CEO of Clara. Clara is an app that connects you to your dermatologist via smartphone. So when you've been at your dermatologist and you've got problems and you want to see is the problem getting worse? Is it better? With Clara, you don't need to go to your doctor again, personality, sit there, wait there until you come, you take a picture, send it to the doctor, if it's okay with your doctor, and then you get information very, very soon. And that will be a very big new market. It's quite big already in the United States. There you're working together with 50 dermatologists, with the renowned Mount Sinai Hospital, and you've got an own office in the United States now already. And one of the interesting things, how does it get on? And to me, it looks like in America, your company is getting much more on than in Germany, which is somehow a bit lagging behind. How does it come that? We're gonna talk. And who's already a big shot in Germany is F.Weiss of Yameda. It's a company, you don't need any introduction here. It's the biggest site connecting people to their doctors, listing doctors, getting reviews of doctors, and now you can directly book appointments with your doctor there, so you can get much more easily in contact with your doctor. And F.Weiss holds a PhD in organizational psychology, has worked as a consultant in Boston Consulting. He was responsible for corporate development and strategy at Tomorrow Focus AG, one of the biggest internet companies here. And we are quite interested what he tells us about Yameda, which is now going really, really big with 5 million patients, with 1.3 million reviews on its website. And to me, it happened last time I was at a physician after I was treated. He handed me a tablet and asked me to fill in for Yameda, how he handled. So that's a new situation, how you get in touch with your doctor. And last but not least, we're happy to have with us M.Conroy. She's from the United States. There's this CEO and founder of Capture Proof, which is an app to share medical photos and videos for a doctor-to-doctor and especially for doctor-to-patient communication. So we see some overlap with what C.Pantle is doing. We are quite interesting what you tell us about. And Megan's got a quite illustrious vita. She's graduated in physiology and in photography, which I think is quite remarkable. I just managed first half of it. She became a salesperson at the global pharmaceutical company Abbott. They're pushing 14 new products on the market in just 3 years. Then you changed your life completely, went for 1 year to Paris to do a master in photography, even went to Zambia in Africa for your master thesis for several months. Then came back and managed photography for clinical trials, and then one step further, she started Capture Proof, which is, and Capture Proof is which helps patients and doctors to share pictures. And one of your first studies, which shows very much how much it works, was with the parents of children, small children who have epileptic seizures. With Capture Proof, parents could take a video of their children having a seizure and then showing it to the doctor. So the doctor doesn't have to rely on what the parents tell him, but really sees himself what's happening. Because, of course, if you just go with your child to the doctor, nothing happens there. You don't know when will be the seizure. So you can show it to them, and as you said, a picture is worth 1,000 words. And it's going quite big in the United States, and we are quite interested how your plans are to get abroad. So, yes, to get in contact. And so for me, one of the first questions is to D.Bahr, how do you think from the point of an insurer, is it something, is it an opportunity to make everything more cost effective, or might it be some kind of a cost driver? Because as regarding me, when I've got a problem, I say, oh, I've got an aching, I wait a couple of times till I go to the doctor, and so often it goes away. While if it's just easy, take your camera picture, send it in, maybe there's much, much more doctor-patient contact, which is on the financial side good and bad in the same way. Maybe.
Sure, there are great chances. We see that those technologies could help us in 2 ways. First way, it could help us to get to better communication, to get to better understanding between a physician and a patient. We know that the physician tells the patient the diagnosis, but the patient doesn't understand what we really has. And those technologies could help to understand the diagnosis and to understand what he now as a patient has to do to get to better, and that's the second way, to get to better compliance and adherence of a patient. That's our fundamental question in all the Western countries. We haven't found a way to get to better compliance and adherence of a patient. We know how to keep well and fit. We know how to treat a lot of diseases. We know how to save a lot of money. But why is the patient not adherent to the physician's recommendation? That's the question. And perhaps those technologies could help. I don't guess that that will be, or I guess it would be more cost effective than it would be a cost driver. Because in Germany, we have a cost driver by the freedom of choice. You can choose your own doctor and can go whenever you want there. And average in Germany, a German patient is going 17 times a year to a doctor. And that's very often. So perhaps those technologies could help to reduce this huge number.
So, Simon, how is your experience? How many contacts do patients, how often do patients get in contact with the doctor, if it's possible for them to take pictures?
Well, yeah, services and technologies like ours enable the patient to be in contact much more than just going to the physical visit. And that's what we believe in. We believe that the future of healthcare is that it's an ongoing conversation between patients and the doctor, their healthcare. It's not just the sum of all visits. It's what's happening between the visits. It's what's happening before and after the visits. And this is why a lot of more interaction between doctors and patients will make healthcare much more efficient and much better. So that's coming back to your conversation just now. I'm very convinced that that insurance companies will not only cover what companies like we are doing, but they will actually force doctors to use that, because in the end they can treat a lot more patients with a higher quality of care and can boost things like adherence and compliance. And having more interaction between doctors and patients, it's much more efficient and it's better for both the doctor and the patient. However, it has to be controlled and in a manner where the doctor doesn't lose time and he can, organize that in a way. And this is why the whole concept of healthcare and organization around the physical patient visit will change dramatically.
So, will it be? What do you think? Will the doctors stay online all the time, or will they set up certain slots when they can get in contact? Or?
Yeah. I mean, there are two concepts of going to the doctor virtually. The one concept is synchronous, so you have a video call. That's where doctors have to book a time slot, so it's not much more efficient than actually going to the doctor physically, except you have a geographical thing which you don't have to oblige to, so you don't have to take a day off and go to the doctor physically. But they have to book a time slot at the same time in the same kind of virtual channel. However, what we focus on is we also enable synchronous visits, but we focus on asynchronous visits. So the doctor will take their amount of time at the end of the day during visits and can fill up free slots where they can actually respond to patient questions and inquiries at their convenient time. And the same for the patient. When they have something at 3 o'clock in the morning, they can wake up and just upload it because they're always on. However, this also has to be organized because the doctor doesn't want to be reachable all the time. So the same concept as in real life, like collaboration in the doctor's office, is happening also in for example, our product. We have collaboration where the doctor can also invite his assistants or his nurses or his staff to collaborate on things. So they can only then delegate the case back to the doctor when actually his opinion is needed. So they work in a team also on the virtual visits. And it's very interesting and exciting what's happening in this kind of how the virtual visit will actually look like in 5 years.
And how will the doctor communicate with the patient? How will the relationship be? So do you have an idea how it will develop? Because will doctors still be the demigods to look upon, or how do you think will the doctor-patient relationship be in the future?
Well, actually, we think that we've already changed this relationship, at least in Germany, because patients will be a lot more informed before going to the doctor, and there will be a lot more transparency about the actual quality, the services of doctors in Germany. So basically, we think that it will be another relationship that's more on par. because patients come with information about the quality of the doctor, and they come to the doctor with information about actually what they have. So they have an own opinion on the best therapy, they have an own opinion on maybe their diagnosis, which is good and bad news for the doctors because, of course, if you just read Google and Internet forum, you will not be the same expert as the doctor is. But nevertheless, I think it's important that the doctor now takes the patient serious because he knows that he is informed, and the patient will not accept the only one diagnosis, the only one therapy, but he wants a discussion. And that's something that we think is beneficial to the whole system. And of course, it is beneficial if doctors know that after the patient has been at their practice, the patient is able to share his experience with other people. Doctors are not completely, would not completely agree with this because they still tend to prefer that patients do not talk to each other. But actually, it's just a new era because before patients have talked to their friends afterwards, but the doctor wouldn't know. Now they talk on our platform and the doctor does know, which is actually quite good for the whole system because the doctor then is able to actually learn from that feedback and improve things in his practice. So yes, we think that the development is going to a more equal relationship between doctors and patients.
Yes. And will there be a new relationship between doctors as well when they can share their information, share their photos?
I think one of the biggest things that we're doing is allowing doctors to actually walk into the room prepared. So right now, doctors don't have time to read the electronic health record before they walk into your room, but they have time to glance at 2 photos or watch 2 videos side by side. So having that opportunity to actually enter a meeting prepared, we've all gone to a meeting prepared and unprepared, and we all know how it goes. So having the doctor walk in prepared is one benefit, and then the other is extending the care beyond the exam room. Currently, medicine is happening only in the exam room, and having the opportunity to have a peek into the patient's home is really beneficial.
And with so much information going around, how can you make sure that information doesn't leak? I don't want my bruise to be shown all over the world. I think,
Well,
are there any
capture-proof-
problems with the law concerning now data security?
I don't necessarily think it's problems with the law. I think that the law is setting a standard that we would like to achieve. My work in Zambia showed me that when there's no privacy in electronic health, or in health records, there are no electronic health records in Zambia, but when there's no privacy in health records, there's a possibility for loss of life because you don't put critical information into that health record. So privacy is paramount in health concerns. And so capture-proof meets HIPAA standards and also the Euro Swiss Safe Harbor standards. And I'm happy that our CTO cut his teeth with the DoD and cybersecurity for nuclear plants. So that's his responsibility, and he does that well. But I think that we're doing ourselves a disservice if we don't pay attention to the privacy necessary in order to keep this information safe.
So.
Yeah, and maybe one more. I mean, we started off in Germany. We are now in the US and only in the US, and it's much easier from a entrepreneurial perspective to be, to meet the data security standards in the US because it's clearer. There are amazing companies helping you with this because it's a huge market and the regulations are pretty clear about HIPAA requirement and things like that and data encryption. So they do a really good job in the US helping you to get there in comparison to Germany, where it's a lot more difficult to really understand what is possible and what is allowed and what not.
So does there have to be changes in the German medical system, and do you think do the Germans have to make law changes to make it possible to get on with this as an expert, or do you think it's more a question of the culture of the doctors, of the patients, if you use these new opportunities?
Every time we need law changes, but that's not the question. I think it's because of our history. We have a higher level of data protection in Germany, and it's a good level of data protection in my mind, because it's because of the sensitive nature of medical data. It's not banking data. It's not traveling data. It's medical data. And in my opinion, it has to be the patient who decides which other person has access to his data. He has to be the decider. He has to make the decision if an insurance company, if another doctor, if another physician or a hospital has to have access to his data. And as Simon said, that he wants the insurance or the insurer to force the physicians to get to your technology, to your product. Perhaps there's another structure, or there is another structure in the United States, because you have the experience of an insurance company owning hospitals. You have these HMOs, and we don't have those experience here in Germany. And insurance and hospitals companies are different, not the same. So the Americans accept that the insurer knows a lot about me and tells me where to go, which hospital, and which treatment I need. And that's another experience in Germany. So in my opinion, there could be only success if it is on a voluntary basis, if it is on a voluntary level, and the physician decides if he wants to be part of those technologies, if he wants to share the data, but it has to be the patient who's deciding and not the insurance company.
I would like to add one thing to the data privacy issue, because I think it's, of course, first of all, our most important duty and responsibility to meet the highest standard of data privacy. But I think at the same time that we as an internet industry can also do a little more about educating patients or consumers about why it is interesting for them and beneficial to actually offer data. Because I'm still amazed when I install a new app on my iPhone, I still get this message, this app wants to access all your contacts and your calendar. And of course, my first reaction is no, because there's no benefit in it. But I think we can do a better job in actually educating people what the benefit is of sharing the data. And I think there's a lot of benefit in sharing data also in medical services, in the apps that we represent here. So I think it's both. We have to meet the highest standards, but we also have to educate both sides what's in it for them. That's one thing that is, I think, important. And the other is, when we're talking about, for example, electronic health records, we have to think about who's actually owning the data, who should physically own the data, and who should own it by law. And it's still fascinating when we talk to our doctors, and maybe you have the same experience as a patient. When you ask your doctor if you could have your patient data because you want to move to another doctor, it's usually quite difficult because he's reluctant, because doctors still have the feeling that they actually own your data, which is counterintuitive for me, because I think the patient should actually own his data. And then, of course, the next logical question is, where would you like to store this data? I think there's a representative from Connected Health here as well at the DLD, and I think that they have a new solution. They're working on a solution where you can store all your medical record on your smartphone and just connect it to a docking station at the doctor's practice. And maybe that's another way of thinking about it and not having it in the cloud. So I think we just have to be smart enough in educating both sides about the benefits of sharing data, and we have to be intelligent and creative enough in inventing the right technological solutions for it.
And the funny thing about working with data is that people you don't like to, for example, if you got an illness you feel ashamed of, there are quite a lot of you don't want to talk about. It's there's a big barrier of shame before you go to a doctor and talk about it, while on the other hand, talking about this on the internet for many people seems to be much easier. Is there anything like a reduction of the barrier of shame? Do you?
Well, I definitely think that it's easier to show a photo or a video of something as opposed to looking your doctor in the eye and showing them it on your own body. So there's that bit of anonymity, yes, that word, giving you a bit of distance in order to share information. But I also think that what is more interesting is the fact that you're actually documenting progress over time. So if you are a frustrated patient, it is not because you had a fight with your spouse or forgot to eat breakfast that you're having a terrible day and your medication's not working. It's because you were walking this way 6 months ago, this way 6 weeks ago, and now you're walking this way today, and your medication is or is not working. So really having objectivity and evidence put back into evidence-based medicine is extraordinarily powerful, regardless of where you are when you share that data. And
is there any danger that the doctor doesn't see a real problem if he gets the data from via the internet? If you send a picture of your problem and you just send a few days later a picture of the same problem and it looks all good, but while the rest of your body maybe is just falling apart and the doctor only sees that part. Do you think there is a problem with that?
Well,
Of course not.
Definitely a big problem. No, I think what services like ours are doing is connecting doctors and patients. I mean, we are focusing on after the in-person visit, once the diagnosis is really done, and then the doctor and the patient staying connected over time so that things like this don't happen. But I think in general, these services, like services which are increasing access to doctors, are actually solving these problems, because there are so many people who just don't go to the doctor at all. And the danger of having like a bad disease at one of these people without that kind of access through technology is much higher than giving them, you know, the technology to do the first step, or to maybe even doctors our doctors also report that some patients are actually starting to report different things like sweaty hands, and they have some really bad rashes on their face, and then they report that like there's some psychological things as well, and then they start a conversation about a much deeper problem, which would probably not be realized without this kind of continuous contact between doctor and patient, or between patient and care manager.
And I think that it's important, even though there is this continuous contact, that sounds really cumbersome and can actually sound frightening to physicians, like how will I ever have the time? I mean, the most valuable aspect any of us have is our time. And in studies that we've done with Capture Proof, say for total knee replacement patients, there was an arm that went through traditional therapy post-op and an arm that went through Capture Proof therapy. And it saved clinicians 66% of their time per patient, but got the patient to the same outcome. So just because you have the ability to continuously track doesn't mean it's taking more of your time. I think that's an important point to make.
Yeah, and it also gives access to the doctor's physical visits for patients who really need it, because some patients just don't have to go to the doctor. In dermatology, which we are focusing on right now, we're going to go to different medical fields, but talking to all the doctors, it's about 50% of all their patients don't actually have to come. It's enough if they send a photo and saying, this is how it looks today, and the doctor says, yes, no, take this, increase your dosage or something like this, and they just block the waiting rooms. So between 40 and 60% of all patients every day in the doctor's office are patients who are coming back for a follow-up, which don't have to come back. And the doctors can give other patients which need the access to physical visits, which have to wait now 3 months, 6 months for a dermatology visit.
But on the other hand,
the waiting room, the waiting time for a dermatology visit is also, I think, on average 30 days.
7 days. Average in Germany.
Yeah?
7 days.
I don't know.
Somewhere between 7 and 30 days.
Yeah, but on the other hand, many.
The problem is, sorry for that, Mr. Moderator, but the problem is if you go to your doctor and he's only looking on this detail on your left leg or left arm, and he doesn't look on your whole body. The same problem if he only looks on the photo. So, in my opinion, you have to find a way for a physician who's deciding which patients he can consult, or he can advise better that way. He can advise via those services. But in my opinion, it's not working if it would be the first contact via an app, a photo app, and then deciding going to doctor or not. So that's a service which is only for follow-up, that's right, but not for the first contact.
And many patients.
Except for epilepsy. Because you have you describe something and you say shake and he says twitch and you say shudder and I say another word and it all sounds the same, so everyone's urgent. But in the US, we have a 72-day wait time for child neurology visits. So in order to see the video of what this concerned parent who's maybe taking their baby to the brain doctor, so they're pretty stressed out, is talking about, you have the capacity to reassure parents in a way like never before. So you can more accurately triage. It doesn't mean the patient shouldn't eventually come in, but it just means the most urgent kids get in fastest. So I think there is a way for it to be the first contact.
Might it be a problem for some patients? A lot of people need a personal contact, to talk to someone, to feel someone, and the placebo effect is very, very important for a lot of people. Even if you say people it's a placebo, if you've got a feeling of being taken care of, many people are much better. Might that be a problem if you've got a telemedicine that a reduction of personal contact?
We asked our insured persons by Allianz, private health insurance, and they told us they want to have private contact to their physicians or even to their insurers. And we asked them which way, and they answered via Skype. And that was really interesting. So they think Skype is a personal contact. That's really what was quite amazing for me even. But they accept those new technologies to stay in contact with their physicians. And in my opinion, there could be a good way. Of course, 17 times at average in Germany is a huge number of personal contact between physician and patient. And I think we could reduce it via those services. But at the end, which is our problem? Our problem is not the patient who's going to doctor, I think, 2 times or 4 times a year, and then he has something on his skin and asking himself if he has to go to the doctor. Our problem in healthcare expenditure are 3 numbers. In the European Union, 40% of population above the age of 15 have a chronic disease. And chronic diseases account for more than 80% for deaths in the European Union. And third number is between 17 and 80% of healthcare expenditure in the whole European Union is for treatment for chronic diseases. So those technologies, in my opinion, could be very helpful to get to better compliance and adherence of patients with chronic diseases. They have to go very often to a doctor, but usually you don't like to go very often to the doctor. And so those technologies could get to better communication, could get to better contact with the physician. Perhaps that's the best way to define it for patients with chronic diseases.
Yeah, I actually think that the whole efficiency debate we are now in the middle of, it's actually has manifold aspects. And one is, of course, how often do you go to the doctor? Do you actually prevent a physical visit at the doctor because you can see him online? Another is, of course, therapy adherence. I think you've just been talking about it, making sure that the patient, once he's released out of hospital, actually sticks to the prescribed therapy, takes his medicine, goes for a walk, whatsoever. But I think that we are also talking about another aspect of efficiency, and that's one of our core competencies at Yameda, and it's about finding the right doctor and making sure that we have transparency about the quality of doctors, because what we see now in Germany is that more or less every doctor and every clinic offers all kinds of services and is not really specialized on the one service that he's really good in, and patients don't know that before. So more transparency in the whole sector will actually lead to 2 different objectives. The first is the patient knows before he goes what kind of doctor he will meet, and I'm not only talking about the specialty but also about the personality. Is it a doctor that listens to me, that takes time, or is it exactly the doctor I'm looking for because I don't have time, I just want my medicine? So we are trying to actually lead the patients to the doctors that are good for them and actually help doctors find the patients that are a perfect match for them. So I think that's also another aspect of efficiency in the healthcare sector, not only the quantity of visits per patient, but also kind of leading the patients to the right doctors. Because I think there's a lot of potential and efficiency as well in the system.
Right, and how do you make sure that the reviews... This problem is with reviews is always the people who are not satisfied, they write big reports and all stuff. When everything goes right, I go there, I'm treated, I'm healthy, fine, I go home and don't think about it. And that's a general problem with all the Google and health stuff in the internet. 70% of the people get the information only or mostly from the internet. And how do you make sure that it's not just the people who are not content, the people who are angry to get that bias?
Well, we have, I think, yes, we do have the highest standard of quality management in the whole industry. We have a dedicated team that doesn't do anything else than checking the authenticity of reviews. And we have a highly sophisticated algorithm that checks each and every review we get. Right now we get about 1,500 new reviews every day. And our algorithm is a set of more than 40 different indicators that looks through every review we get. For example, the IP address, the browser hash. We're looking for keywords, making sure that 2 things don't happen. That patients write about doctors they have never seen. or that maybe doctors write about themselves because they like to have reviews written by themselves. And our system is very well apt to figure that out. And we have a team that actually manually reviews all those patient comments that we get. So that's one very important thing. And we make sure, completely independent of the status of those doctors, whether they are clients of us or not, we make sure that each and every review is actually authentic. And of course, we make sure that we comply with all laws that are out there, that there's no wrong or false facts in those reviews, that they do not blame physicians, but that it's an objective language also in those reviews. So that's very important. But I would like to add another point to the whole review issue, and that's that often physicians contact us and they say that, hey, reviews are not a really good way to actually reflect the quality of my services. And then we often say, okay, so what is? And they don't know, because it's hard to tell actually the quality of a doctor. And we see that there are many studies out there that actually find a high positive correlation between the perceived quality of a doctor and actually the medical outcome. But we are further on the way when it comes to quality of hospitals. When we're talking about the physicians in their practice, it's very hard to tell how good they are. And right now, reviews are a very good indicator for that. But we are more than happy to work together with the industry, with doctors, to actually develop other indicators for quality. But it's very hard at the moment.
So, when you take a look in the future, 10 years, do you think that doctor-patient relationship will have fundamentally changed 10 years from now? Or do you think the system is so inert to changes that it will be more on the surface? I would like to ask every one of you, how do you see, how are we going to be in 10 years, in 20 years? How do you see the future now?
I'm absolutely convinced, and that's more or less what I stated right at the beginning, that the relationship is already changing and that it will change even more in the future. And that's doctors really seeing that the patient is informed when he comes and that he wants to take part in his own therapy. He wants to be involved, and he wants to see that the doctor's actually listening to him. So I think that will change. Of course, we are also doing our part to bringing doctors online. It sounds crazy, but still most of the doctors in Germany don't have an internet facility, internet-connected computer in their practice, because internet is still bad and they think that it's going away, but it is not, and we're trying to help that, and that's definitely changing something, because right now you can get information about your doctor. You can see real time at our platform. You can see in real time when the next doctor actually has an appointment for you, has a free slot in his practice. So that will certainly change. So yes, and we think that the relationship will change because it makes a difference for a doctor knowing that the patient coming to his practice knows something about him before. So he does have to have a different attitude towards service and communication with the patient. So yes, definitely it will change.
So maybe quickly, what I think is that everything which can go online will go online. Books went online, electronics went online, retail is going online, food is going online like crazy. Same is happening in medicine. Everything which can go online, which is more efficient to be online, more convenient to be online, and also with the security standards we have now possible to be online, will go online. So you get the point. Same will happen in medicine. So I believe that patients will consume all their healthcare online, which they can consume online. So it will fundamentally change that patients will only go to the doctor if they really need to be operated. In America, we see that they can, you can get your blood samples taken at Walgreens, things like that, which actually nurses can do. So there will be a lot of organizational change, but in the end, the doctor will be treating. However, patients will consume the healthcare online, and there has to be technology which is secure, which is documented, which is regulated, and which has a good user experience on both sides to make that happen, to make the whole system more efficient. And I'm really excited what's going to happen in the next 5 to 10 years. But I think our kids will, or maybe I will in 5 years, not go to the doctor if I don't really need to get anything physically done from him.
In 5 years already, you think so?
Definitely.
We actually believe at Capture Proof that medicine is a study of patterns. And it's really when you deviate from your pattern that things are interesting. We just heard in the talk before about the idea of having something implanted, or even HealthTap talking about the sensors that are going on the skin. And having this data that currently is nice to have data and contextualizing it with the visuals so that doctors have it as need to have data. So they understand what your heart rate delta is or what the red delta is post-op is where we're going. Where I really think we're going is a girl walking down the street with her dad who suddenly falls over with a heart attack, and a drone shows up with a machine to shock the dad back to health, and everybody continues along their way. So I think that that's something in 5 to 10 years that we're going to do, and especially as our infrastructure continues to deteriorate, that we will start to make really interesting and exciting decisions on how we're delivering care.
It has already changed. 10 years ago, we only look on private health insurance as a fast and quick reimburser. He has to be very fast and efficient with the reimbursement of your invoice. But now our customers want to have an insurance which is a partner for life. For example, we offer a second opinion. If you got your diagnosis and advice for treatment, you could get a second opinion by doctors via the insurance. Or for example, we have, we call it a Gesundheitswelt, a health world, I don't know, where you can inform yourself on treatment, where can you inform yourself on diseases. Or third, you can schedule your appointment on doctor via your insurer. That was not possible 10 years ago. So it has already changed. But still, my opinion is we want to get to a well-informed patient. We have to reduce the information asymmetry between patient and physician. But still, I don't want to have a see-through patient, a totally transparent patient. It has still be the patient who's deciding who has access to his data. That's fundamental. In other ways, we won't have the acceptance of those technologies. For example, I made a law when I was health minister in Germany, I remember, and I made a law that allows telediagnosis in general, because in Germany we don't have a statutory health system, we don't have free market like you have in the United States. We have a self-administration system, it's called in Germany. And I made as a health minister, I was responsible for the framework. We allowed this telediagnosis, but the physicians' organization in Germany is still against it. So they don't accept those telediagnoses, and that's still, they have good reasons for that, for liability reasons and so on, but that's the problem. So if you want to have success with those technologies, you have to convince the patients and even the physicians to get to this success.
One last word.
Yeah, I just think that there's a definite point there to be made that the best marketing any of us can do as mobile health companies is scientific research and studies that show both to the patients and to the doctors how this product works and how, you know, the tide rises all boats. We're all hoping to help medicine become more efficient and optimize it. But we're all doing ourselves a disservice if we're not out there in clinical trials having doctors using our system in randomized ways that will actually give us data. I think that that's really important.
Okay, I say one.
No, okay. Sorry for that. But we talked together before this panel, and
yes.
And I'm wondering if it is a good idea that that those technologies are sponsored by pharmaceutical sector, and we have another law in Germany than in the United States, but. You need those technologies, you need those ways, right? Clinical trials. We made the same experience with our cancer registry law, that the patients accept to share their data for this research. But if you combine those ideas with a service for the daily life, and that is sponsored by pharmaceutical sector, I'm not sure if that's the right way for get to higher and better acceptance.
Especially in Germany.
All Europe.
In all Europe. Okay, thanks a lot to everyone.